Good morning, everybody. Thank you for joining us today for our third of our series of how to better contain healthcare costs. Today, I'm very excited to introduce you to Tom Weitzel. He is with Prater, and this is a company we've been working with for almost 2 years now, and actually have it in place for our company and our employees. This is a tool that can definitely help you save money on your health insurance costs, whether you're fully insured or self-funding your insurance, whether you're big or small. Prater provides 24/7 easy access to cost transparency for many medical procedures. Many people don't realize the wide spectrum of cost for various services like MRIs, blood work, different labs, and other procedures. Just having at your fingertips the ability to type in your zip code, find the convenient locations for you, input the service that your doctor has asked you to receive, you can oftentimes see several hundred to several thousands of dollars of difference. So this can not only help your employees save with their out-of-pocket expense, it can also reduce your claims costs and certainly help you better manage your premium costs. Prater offers so much for very little cost, and it's certainly a cost that is more than covered with your out-of-pocket and premium savings. So without further ado, I'd like to introduce you to Tom Weitzel. He will take you through the program, and thank you all for joining us this morning.
Before we get started, I just wanted to mention a few housekeeping items. We will provide everyone with a copy of the PowerPoint presentation, the webinar replay, and any questions and answers from the session within the next few business days. And also, if you have any questions, please type your questions in the questions box and hit send, and we'll answer your questions at the end of the presentation. So now we're going to turn the presentation over to Tom.
All right. Thank you both. I appreciate that. Thank you for the introduction, and thank you, JRG, for your continued partnership and allowing us to speak to the group today. Again, my name is Tom Weitzel, and I am with a company called Prater, and we are a medical cost transparency company. And just to start at the very beginning, we get our name from the combination of two words, which are price and matters. Okay, that is what we are focused on, is cost. So what does Prater do? Prater redirects employees to low-cost in-network providers for common medical procedures. And we do this in order to save money. So the biggest takeaways from our value add statement there are that we are simply looking at in-network providers. Okay, and this is important because we are not adding facilities to your network. We are not creating our own network. We are simply looking at the current network and the price variability within. Second is that we are looking at common medical procedures. And we look at common medical procedures for two reasons. Number one, because we want employees to change their behavior. The procedures that they are willing to change their behavior on are those common procedures, which brings us to our reason number two, which do not have quality metrics associated with them. Meaning that there is not a different infection rate, there's not a different outcome for these procedures. And these procedures include, and this is as Jessica alluded to, your x-rays, blood work, CT scans, and any kind of imagery. Now, what kind of sets us apart from the competitors in our space is that we actually are a custom solution. And what that means is we actually acquire and analyze de-identified claims data from our self-insured clients. And what this enables us to do is, number one, determine which facilities and procedures to redirect on a company basis Not everybody's top 10 procedures, cost drivers are going to be the same. And we'll get into an example of that here in just a few minutes. Next is that we're actually able to take a look at your spend, because we do it this way, and size up the opportunity for your plan and your organization specifically. So we can see where you have been going and how much money we can actually save if we go to lower cost in-network providers for these common solutions. Next is we also display the charge and claim allowable amounts by carrier. We are the only ones in our space doing this, and it is because we define transparency as knowing the most that you could possibly be charged, that is if your claim is denied, and then what the exact amount to the dollar your insurance carrier pays for that procedure. Now, as we go on, just a little bit of history about myself and also Prater. Okay, we were founded by a physician. So this physician has been practicing for 30 plus years and also started a medical billing company about 15 years ago. So he went from hearing about the cost variance for these common medical procedures from his patients, and then once was able to take a look at the medical billing data, saw it with his own eyes. And that is really where the idea for Prater was born. And myself, I am a management information systems person. I love business process reengineering. And the reason that I am with Prater is because I know that we are able to have a big opportunity for savings here simply by educating our workforce on, number one, that we can shop, and number two, how much of a variance there is between these common medical procedures. So before I joined Prater, I had to kind of step back and say, how am I buying these procedures? And it really blew me away. So if I may, just a quick anecdote. I had a problem with my shoulder. I tripped and fell, and instead of falling on my infant daughter, I braced myself with my shoulder, and I know I needed to go get an x-ray. So I go see my primary care physician, and he's a friend of mine. I say, hey doc, you know, I hurt my shoulder. I think I might need an x-ray. Doesn't even look up from his computer, says, hey Tom, yeah, you know what, you're right. Let's go ahead and get that written for you. So he pulls out a little tablet, and at the top of this tablet is the logo, name, and location of his preferred hospital lab facility. He simply checks a box on it, hands it to me. Say, okay, thank you, doc. I walk out of the examination room. I head to the front desk. Nice lady at the front desk says, hey, Tom, when are you available? I'll go ahead and get you booked for your lab work. I say, oh, thanks, Jessica. I appreciate it. It's right next door. So instead of putting it on the calendar, I'm just going to go take care of it right now. I say, okay, great. So I go next door, and before they'll see me do my x-ray, I have to sign a piece of paper. And I'll be honest, I have never read this piece of paper until this day. This piece of paper, and I'm paraphrasing here, but in general, essentially says, feel free to charge me whatever you think is fair. If my claim is denied, which happens 20% of the time on average in the US, then you can charge me twice, on average, what you would have charged my insurance company. Now, if that sounds familiar to you, don't feel bad. We have been conditioned this way, okay? It's just the way that it is. We do not know that we're able to change because we have been corralled like cattle. So number one is realizing that there is a price variance and that we are able to shop. So there's education that needs to go on there. Secondly, what we're attacking is that we don't necessarily know how much of a variance exists for these common medical procedures within our own network, which is exactly the need why we need to shop around. We need to be medical consumers now that we have high deductibles, now that we have the healthcare landscape that we have it in. We now need to shop around. So how do we do this? We have multiple engagement methods, but first I'd just like to show you a search, if I may. If we just go simply to our website, bear with me one moment as we get this to pull up. Okay, Okay, you will see on our website, the landing page here, each employee of a client will get a login and username, which they will need to input here. We're going to go ahead and log in. And now we are able to search over 625 different medical procedures and find their pricing. So we have gone to great lengths to make sure that this is an easy process to search. And as you can see here, you can go down by category. Let's say I'm looking for a lipid panel. I can simply select blood work, go down. Once it catches up, there we go. We're going to be able to go down and select lipid panel. Another option is I can go in and search by name. Simply start typing, and lipid panel will pop up. Next, I just want to put in my zip code, and I'll hit search. Now again, we have also gone to great lengths to make sure that what you see next as far as the search results mirror what you would see if you were searching for anything else that you would want to know the price of, and that we're able to search for, such as an airline ticket or a hotel room. Okay? And we do, of course, get the plan information for your group. So we will show the in-network versus out-of-network facilities so that you can see all of those available facilities to you. And because there is an education process, because we have been conditioned not to shop for these common medical procedures, we do need to educate our workforce. And that starts with implementation. Prater comes in and will educate your workforce, show them these exact searches, educate them on what being self-funded, if you are self-funded, means, and really get their buy-in. Empower them is what we're trying to do. But we also have to educate. So for blood work, for example, the price listed does not include phlebotomy, which is usually $10 to $20. We use what's called a CPT code to be the identifier for these prices. Because of that, we're not able to add anything to this CPT code. So we just need to let you know there may be a $10 to $20 fee on top of the charge that you see below, but you're still comparing apples to apples down below because they will all have this fee added to them. Secondly, we're also going to let you know just a little bit of heads up about what you may need to know about getting blood work if it's not at that lab facility with the hospital. If they're not part of the electronic medical records, you may just need to have it faxed. So essentially, you need to know the name of your primary care physician. Okay, that is it. But why would you want to do all this? That's what we're going to get to in just a moment. First, if I may, I'd like to explain the prices that we're seeing here. First, you see a charge amount. The charge amount, and you can see here, is essentially sticker price for a given medical procedure. And the reason that we show this is because it represents the total financial risk for the employee. Now, we are a cost savings company, but we do also provide employee benefits. And my opinion, the biggest employee benefit that we provide besides cost savings is the basic ability to budget. Okay, it's know before you go pricing. You no longer, if you go through our website, will be concerned with getting an outrageous EOB or bill a month or two later after you go get a procedure. Because you know, worst case, if my claim is denied, whatever happens, this is what I would be stuck with. You know before you go to that facility. Second, we're going to see a cash price. And this cash price is the same one that you would see on their website or actually in the facility if you were to walk in. It does not mean you do not have insurance. It means you can simply pay cash for this procedure at this facility. And this is what it would cost you. Lastly, what you see here is an average insurance company payment for this procedure in this zip code. Now, once we have your information on site and you are loaded in, we will be able to actually display the claim allowable. So this would be, for this example, right here for $20, the claim allowable would be closer to about $8 or $9. Okay, and for, let's say for this one, it would be closer to about $35. Okay, once that is live. Now that we know what the pricing means, let's take a look at why we would want to possibly shop around. So if my average insurance company payment for this procedure, which is a lipid panel, is $96, that would lead me to believe that I shouldn't see too much charge rates past this $96. Well, as we go down, we're going to see we can get this done for $24 as a charge amount. The average Blue Shield reimbursement for this facility is $20. We go down, we're going to see our $98 range here. And then as I go down past about middle of the page, this is where it gets drastic. And this is where employees really feel empowered and also a little bit taken advantage of, because we don't know these prices. We're simply going where our doctor tells us. And you'll see as we come down, we're getting past 165, 257, and we are going to top out at $1,972 for a lipid panel. Granted, this facility is Children's Hospital. We would not be looking to redirect any type of urgent care. Again, we are only looking at those common medical procedures in which you have time to shop around. If you are sick, if your child is sick, you need to go get urgent care. However, knowledge is power. And case in point, I have been to this facility 3 times in the past 2 years with my infant daughter. One of the times, we needed to get blood work right away. 2 other times, we did get blood work, but we were simply told, everything is okay. We would just like to run a lipid panel, or actually it was more than a lipid panel, a couple pieces of blood work. You can do so on your way out. $918 was charged to my wife's school district, all 3 of those times. The last 2 times, on our hour and 20-minute ride home, we passed by at least 5 facilities that could have done it for $25, $30 or less. So again, knowledge is power. And for me personally, I do not care where I go to get my blood work drawn. That is me. Wherever I go, I get the new person. They swell me up to the size of a golf ball. It does not matter. To take that a step further, for a chest CT scan with contrast, I have gone through and vetted these facilities. All but 2 use a machine manufactured by General Electric, and it's less than 7 years old for depreciation purposes. So in my mind, I shouldn't see too much of a variance. However, that is not the case. As you can see here, we start out on the low end at Monroeville Imaging Center for this procedure at a $525 charge amount, a cash price of $275. And again, once this is live and we have your info, you would be able to see this. For this procedure, it's close to, for Blue Cross, right around 212, if memory serves me correct. We're going to go down. We're going to see a few others. You can see we also have average Blue Shield reimbursement for this facility, close to their charge amount. So you can see it's not always an even split. We're going to go down. Middle of the road is right around $1,500. And you can see as we continue, we're getting up towards $7,615. Other questions are raised by this search as well. If these facilities are all owned by the same organization, why does it vary if we're using the same machine? And again, it is not just directly related to these 4 letters. Okay, there is major variance even if you take out that player. So a charge of $25.10 versus $575, I think we can all do the math there and see what kind of savings we would be able to recognize. Lastly, what I would like to show you is, of our 625 medical procedures, not all of these are going to be common. We do also provide you with surgical pricing and some other facilities that do have a quality rating associated with them. Now, why do we do this? Another case in point, you're getting a little bit of my medical history here, is we want to empower you. It's simply, if it's nothing else, to have a conversation maybe with your surgeon. So I am a lucky recipient of a hip replacement within the next 10 years. Thank you, high school football. And I have to kind of take a look at where I want to go. My surgeon wants me to go to this facility. Okay, and this is the facility charge amount only. This does not include any hardware. This does not include nurses, anesthesiologists, doctor, surgeon, nothing. It is simply the right to use that facility. So, and I am perfectly comfortable with this hospital, which is a mile from my home. My daughter was born there. I'm perfectly fine with it. So what did I say? I had a conversation with my surgeon. Said, hey, doc, why do you want me to go to this location versus that one? His answer to me, verbatim, I thought you would be more comfortable, Tom. I said, well, thank you, doc. I appreciate that. But what about outcomes? What about infection rates? Do I need to be concerned? Okay, well, it came down to no. And he continued to take a look at pricing because he's never seen it before either. That's what we need to remember. Okay, this is a secret pricing structure. Again, if you have any questions, please let me know through the text. Moving on from our search, we can have the best website in the world. We also do have a mobile app. But if we cannot get employees to redirect and change behavior, it is pointless. So we have 5 proven engagement methods to drive this change of behavior. Again, it's all about education. So we come in and educate. That's our number 5 down here, a communication plan also. But at number 2, we also have a cost concierge service. So I mentioned that we are under the umbrella of a medical billing company. We have an 800 number where employees are able to call in and speak with a trained medical biller to be redirected to the lowest cost in-network facility for your network. They can also schedule that appointment using our billers and field carrier questions and then be transferred to the carrier if need be. Third, and this is one of our best engagement methods out there, it takes the guesswork out of knowing where you should go, is our Prater savings card. So the front of the card just says Prater, I would say JRG, it has your claim number, our 800 number on it right here, and it's the size of a business card. So we want it to be a companion to your insurance card, and it would simply be, and this is per organization, we've just decided with your organization that for an x-ray, for blood work, for an MRI, and for this group, this is an older retired group, some other procedures we may put on here that are high opportunities for savings. And we have already decided and told you the lowest cost, 2 or 3 of the lowest cost facilities that you can go to are right here. This is where we would like you to go as an organization, whether it's to save you money on your deductible, or it's maybe we have set up and said that none of these locations have copays, or we simply do a taxable gift card or cash incentive to incentivize our employees to go this way. It's important to note that they do not have to. And I believe that plays a big role in our engagement levels. And our early adopters then tell the rest of the employee base, you know, hey, I went here, I got a $25 or $50 gift card. And not only that, I was in and out in 10 or 15 minutes. They were super friendly, and I didn't have to go into a broom closet to get my MRI, right? It's very, very quick and amazing how this can happen. They come back and tell the rest of the group. So again, quick reference, and this is customized for each individual employer. And we just mentioned number 4, which are the financial incentives. If we have a low deductible, highly recommend a financial incentive. For the employer, we set these to make sure that you are getting an incredible return on investment. You can see just from some of our searches, a $25 gift card could save you upwards of $500 each single time, depending on where everybody is going in your network. And then 5th, of course, we have a communication plan. Because this is all about education, we must educate continually with our workforce. Okay, we have some other incentive options here. Again, we can discuss, and we measure this. JRG manages it. Okay, this is how we start a multi-year conversation. Once we're able to get this data in, we can talk about direct pricing. We can talk about community hospitals. It's really endless from where we're able to head from here. So next, we've kind of already gone over that, is I'd like to show you where we are as far as our current engagement levels with our ongoing case studies. We have, as you can see here, 3 case studies started in 2017 Q1. And we have some union and some non-union here with some average age difference 50 to 28, so we're all over the board. Employer 1 does not use an incentive program, or incentive administration program. It is directly reflected in their engagement levels. Employers 2 and 3 do, and you can see they're trending at 49 and 47% respectively. So it is my opinion that an engagement method is crucial to success, but still, even at a 26% engagement level, they are seeing some major savings, which is realized and sized up through the medical cost savings analysis, which we're going to jump to now. If we can here, bear with me. Let's see. All right, great. So what we're looking at here is the analysis for the de-identified claims data for a 3,300 life case in Pennsylvania. It is a school district. And as you can see, when we go down, this group had, this group had a $7.95 million spend last year minus RX. So in our analysis, we break that down into category, give you a nice little graph here. But where we really shine, forgive me, there we go, is where we break down the top 10 procedures by dollar amount spent, and then the top 10 procedures by frequency. Now, a lot of groups, rightfully so, are very concerned with the catastrophic claims, the cancers, the preemies, as you should be. But we do not want to lose sight of that Starbucks coffee that we might be having every day. And this is how we're able to find our Starbucks coffee. Another important note is that 10 procedures alone account for $3.2 million of an $8 million spend minus RX. Not quite half, but very close. So this is a big chunk. Now, as we go in and take a look at what exactly is here, we see at number 1 and 2 are our physician office visits. This is exactly where we want to see this, because number 1, we would never be able to redirect an employee and change their primary care physician. They wouldn't do it. I wouldn't do it. Also, there's not a lot of room for savings, even if we were to do that. Coming in at number 3, however, is a completely different story. This group spent $340,000 on physical therapy exercises at an average of $116 each. At this time, if this were your data, I would be able to show you 3 or 4 in-network facilities that can provide these same exercises for $40 each. And that is a real number in our Pittsburgh market. $40 or less each. If we were to do that and we had everybody redirect, we're saving $200,000 on physical therapy alone. So this physical therapy would also be put onto that Prater savings card for this group, because it is a high opportunity for savings and somewhere where we want to focus. We go down, we see ER visits. And what's important here is we break this out into levels. So we have level 4 and 5. Those are urgent levels, 4 and 5 being the most urgent. If we had levels 1 and 2 here, they can be redirected. Okay, we need to have a conversation. Lastly, we come down, we see comprehensive metabolic panel. This is blood work, very close to what we searched on our first search earlier in the presentation. They're paying $235,000 total at an average of $144. That is very expensive, very expensive. We can offer 10 facilities over here that can do it for less than $30. Okay, again, major savings, probably $180,000 if we're able to do that. We go down, we do the same thing for top 10 procedures by frequency, and we'll have some new ones pop up here. Here's our lipid panel. They're paying $102 average. That is exactly the one we searched in the very beginning. We know that we can get that done for less. So this is how we're able to size up the opportunity with your own data, see where your employees are going, and see how much we can save you. Before we get into the exact number that we're able to save you, we also provide some what I call business intelligence, right? It's just knowing where your funds are being spent, and also what percentage of these funds are being spent on blood work, imaging, and elective procedures, respectively. And just from our searches alone, from what we learned today, I'm sure that you would agree that for this facility right here, if I have 30% being spent on blood work and 36% being spent on imaging there, I have some work to do. We do not want our imaging and our blood work being done here because we know what that costs. We go down, we do the same thing for frequency, and then we get into the real gold here, which is what can I save? If we take the top 10 procedures by cost, top 10 procedures by frequency, add them together, we get a total cost of elective care, and we say essentially, okay, if every single employee last year went to the lowest cost in-network provider, right, this would not happen. We're not at 100%. It's unattainable. We have a 92%. That's pretty close. But again, in a plastic bubble, in a perfect world, what will we be able to save? And for this group, the amount of that variance accounts to $3.56 million worth of savings. That is more than half of their total elective care that they are spending. So again, half of their costs are in variance. So what does that mean? What are we able to do with that? That's in a perfect world. We need to tie that to our engagement levels that we are seeing. Again, from our case studies, you can see we're trending closer to the 50% mark. However, we want to make sure that that 25% under promise, over deliver, whatever the case, is still a good number. And it is indeed in this case. If they get 25% engagement, only 1 in 4 employees will actually change their behavior. They will save $890,000 each year at a 25% engagement. You can see that at 1.7. This is an in-network calculation. We will also do an out-of-network calculation. We will work with JRG to do so. If there is a major opportunity for savings by adding someone to your network, we will bring it to your attention. That is an added administrative burden. It's not something that we take easily and want to do easily. However, if it's going to save you another $500,000 or $1 million, we will bring it to your attention. Furthermore, you will be assigned an account manager. And if you do the incentive analysis, incentive administration and communication through Prater, you will also have the account manager who will work with you through the entire process, setting the amounts for the incentives, and also making sure that the correct facilities and procedures are being redirected, and if there's anything that we can do to improve that process on an ongoing basis. This report, the medical cost savings analysis, is provided before implementation so that we can size up the opportunity, make sure that it is a good fit. And we also provide it to our current clients on a quarterly basis. And this is, again, to check progress, to check savings, make sure that we're on the correct path. And of course, as simple business intelligence, knowing where your funds are going and how much you can possibly save. Lastly, and we're going to wrap it up here shortly, is we also provide a complete cost data listing to our clients on the quarterly basis. And this comes from a request from CFOs saying, you know, look, this is the biggest bill that I pay, maybe besides salary, and I don't necessarily get an itemized bill back showing what I paid for. We have the data. We're able to supply that to you. So this is page 1 of about 50 for this group. And it is just that, an itemized billing, showing you what you paid for and where. Okay. Now, lastly, medical cost transparency. There are some other players out there. The biggest one differentiator for us is that we are not tied to any carrier and that we are a custom solution. Okay, we define transparency a little bit differently, And to us, that means that, being tied to a carrier may be a conflict of interest. That's really what it comes down to. For Prater, we are a disruptor. Please check us out in our recent press, as you can see here below. We are looking to change the medical landscape in our country. And we are sitting on an opportunity here where if we're able to do this for every organization in the country, we would be able to change gross domestic product for our country, right? This is about empowering employees. This is about educating them on the variants that exist within network, why they would need to shop, and how to do it. Thank you for your time today. I greatly appreciate the opportunity to discuss our cost transparency platform with you. And again, appreciate our partner JRG for the opportunity. And thank you again. Does anybody have any questions?
The first question, I am an employer with 30 employees. Can we still save money and expect a return on our investment?
Great question. Yes, you can. I would assume too that you would not be self-funded or maybe level funded. We are in Pennsylvania able to serve smaller employers, and indeed you will see a savings. The cost of our program is not substantial, and you would, of course, see a savings. The opportunity is too big. Thank you for your question.
We have another question coming in. I'll read it off in just a moment.
Thank you.
Okay, the next question. Could Prater be a tool to help us look at self-funding?
Absolutely. Absolutely it can. So in Pennsylvania, because we have a wealth of pricing in our database already, we are able to essentially provide you the benefits of being self-funded, meaning that we are able to take a look at all of the possible facilities within your network, which we would only be able to do with a self-funded group, and know the pricing behind it because we've gotten it from other groups in the area. It's really about crowdsourcing. So again, we would want to work with JRG to really take a look at, number one, getting you on the platform, seeing where we're able to redirect, and then again, look at the right self-funding option for you and really getting you kind of set up for it and even getting better rates going in by reducing your claims in the first part by using Prater. So great question, and we can go on for quite a while on that subject. Please follow up if you would like to.
Okay, the next question. We have only 8 employees and are in Columbia County where the number of providers are limited. Could we still expect cost savings with this option?
Great question. Great question. So in instances like that, and one of my favorite things about Prater is that we are indeed that custom solution. So if you are in a rural area, that does of course cut down the opportunity for multiple facility savings a little bit. So we would have to look at that on a case-by-case basis. So if there is interest there, I would simply just need to know the network, the exact area, and we would take a look at the common medical procedures within your area, the variants that exist between them, and we would be able to make a decision once we're able to provide that analysis. But we would want to make sure that you would have, of course, a return on investment and some savings associated with implementing the program.
The next question. Insurance companies do not give us this kind of detail. Can we get this working with JRG and Prater? And if so, is this info shared monthly?
Yes, and I assume the info, meaning the medical cost savings analysis, yes, we most definitely can. This is, as long as you are self-funded, we are able to get the data. It may take us a little bit of time, depending on who the carrier is, but we have gotten data from every major carrier in our area. And we would do that in conjunction with JRG. Did that answer the question fully?
We have another question coming in.
Okay.
I'll read it off in a moment.
Thank you.
Will Prater help us with an incentive program?
Absolutely. There is a small added fee for us to run the incentive program, but what that entails is that we would completely run the program, and the only thing the employer would be responsible for are the actual funds. Okay, whether it's copay reimbursement or you're doing cash, gift cards, whatever the case, we would design and track that process. So if it is a cash or gift card, we would have to reconcile with someone on the payroll side as it is taxable, but that would be the only reconciliation that would have to happen on that end. And we can go into major detail if need be as far as how that process works at a later time.
Okay, I think that's the end of the questions. I just wanted to remind everyone that our next webinar will be held on Thursday, October 12th at 10 a.m. regarding Guarantee a Successful Employee Open Enrollment. And I wanted to thank Tom for presenting today. Tom, you did a wonderful job and we appreciate your time. And if anyone has any questions, please feel free to contact JRG Advisors at 1-800-556-4699. Thank you and have a great day.